Hair loss isn't just about vanity, it's about confidence, and it impacts how you feel walking into a room. It affects relationships, self-esteem, and even mental health. I mean, it can be frustrating, especially when you've tried everything. There are definitely ways to help support hair health. Thyroid, nutrition plays a big role. Stem cells play a huge role in treatment, and it's a new type of therapy out there. Hair does grow in cycles. You'll see results in about 4 to 6 weeks, less shedding. You'll see some regrowth. Just give it some time. You have to be patient with it. Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Hey everyone, welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
Howdy, and I'm Matt, and I don't have hair.
So you can only guess we're talking about hair loss today.
Hair loss.
And what actually works for men and women. So anyway, that's what we're talking about.
I wish I would have known this in my 20s when I started to lose hair.
We're going to dive into...
Like she really cares, right? So it's all good.
We're diving into what affects millions of people, and no one really wants to talk about it, but it's hair loss. Like Matt was saying, he lost his hair. When did you start losing it? In your 20s?
Yeah, probably started to, definitely in my 20s. It started to thin. And, for men, I think if you're going to lose hair, it's going to happen generally when you're younger. And it does have something to do with hormones. So, men, I don't want you guys to panic that if you're 40 and you start testosterone, you're going to lose hair. It would have happened by now, trust me.
And with women, as we age too, we start to see thinning in our hair. And, some of it's genetic. Some of it, you can look back at your mom or look at your dad and kind of see the genetic part of it. But some of it is something you can control. And sometimes it is hormones, and sometimes it is something that you can fix and help. So
yeah, my dad and brothers have haircuts just like mine. Just so you know.
Your dad has hair, doesn't he?
Well, yeah. I mean, you could say that, but it's very similar.
So let's start with this. Hair loss isn't just about vanity. It's about confidence, and it impacts how you feel walking into a room. I know for women, a man can shave it and go bald, and it's not that, sometimes they look sexy with it. And
thank you. Were you referring to me?
So some men look, anyway. So hair, men can pull off the bald look a little bit better than women. It affects relationships, self-esteem, and even mental health. I mean, it can be frustrating, especially when you've tried everything. And I know as I've aged and have babies, and I've noticed, and having some thyroid issues myself, I noticed a lot of thinning in my hair. And it is a $1 billion business, hair.
Yeah.
Because people do not want to lose it.
And men hate it too. And so, we deal with this a lot, and there's some newer treatments that are probably going to be the best thing that we've ever seen.
Yeah. Hair loss is a mixture of a lot of things. It can be hormones. Like when I say hormones, it can be testosterone. It can be thyroid. It can be, estrogen.
Lack of those for women. Of those things. Especially thyroid is a big one.
Yeah. Optimizing the thyroid does help immensely. We're talking about inflammation, nutrient deficiency, stress can play a big role with that too. And, we talked about genetics. Sometimes genetics plays a role in that. But we treat all of that. And that's why, our results look better, are different than a shampoo commercial.
Yes, that's true. So, one thing we focus on right away, and this fits right into our program, is hormone optimization. Yeah. So getting those hormones optimized, as we mentioned, thyroid, but also testosterone in women and men. And oftentimes we hear, gosh, now that my hormones are balanced, I've stopped losing hair and I've started to grow more hair. And that's pretty life-changing, especially for women.
Yeah. And there's sometimes when we do start hormones, they do notice some shedding though. And so we've had to address that too. And so there's been a few women where they've come in my clinic and they're like, I've noticed that I'm losing a little hair. Well, like we talked about with testosterone, sometimes there is a shedding, but there's also a saturation point. We kind of talked about that before we started this podcast. What did you say?
So there's a saturation point of testosterone in men.
And women.
Well, and women, but I'll just give an example. Let's say a man, if their testosterone level is over 200, which is very low, it's going to have happened already, the hair loss, right? With women, I don't know. You can address that yourself since you are one. What do you think about testosterone in women?
I've noticed a few women, when I've started them on some medications, sometimes they've had a little shedding and they've been a little concerned about it. So what I've done to, stop it, because they felt great, but didn't want to lose their hair. No woman wants to lose their hair. No.
Yeah.
And so what we've done to kind of stop it, there's a few things I've done. I actually used a lot of oral minoxidil. It's actually a blood pressure medication, but used in lower amounts. It actually works really good to help keep your hair in the growth stage a little longer. I know there's a lot of topical minoxidil out there, but it's a little harder to do. But oral minoxidil at like 0.75 milligrams or even 1.25 milligrams works very good in keeping the hair in the follicle longer. Also, spironolactone. Spironolactone is a great one to help hair stay in the growth stage longer. It helps the hair stay here and gets rid of facial hair. So a lot of women love spironolactone. I put a lot of women on
we don't
spironolactone.
give men spironolactone, just women.
Yep.
But men can do well with minoxidil.
Yeah.
Yep.
So those are the two things that I use a lot of to support hair growth. Nutrafol is another one that I actually have used a lot of, but those are some of the things we use. Also, something new recently I've been using is stem cells and PRP in the scalp to help support the hair follicle, to calm down inflammation and also regrow hair. It won't regrow hair where you don't have hair follicles, but it will regrow hair where you do have hair follicles. In fact, I've started injections in my son, and because he's had a little hair loss.
He's following dad's pattern, unfortunately.
Yeah. And so we've had some fun. I don't know how fun it is for him because he's getting injections in his scalp. But
he's concerned about it. He hates it.
Yeah, and he's in his early 20s, he's 28.
Late 20s, yeah.
And, it's very concerning to him, and it's a confidence thing. And so we're going to do everything we can to kind of help support that and keep his hair follicles and growing longer. So injection is the stem cells, PRP, we kind of talked about that. We also use recommended laser caps. Red light caps, yeah.
Yep.
It's almost a laser diode. The cheaper ones usually don't work. It's usually the more expensive ones that...
Kind of like everything in life, right?
But at the same time, they really do work. The red light therapy does work, helps stimulate that blood flow and growth of new hair follicles. I've used the Cure Cap system before, and I know it works. I've used it before. My son's used it, and they do work. I've used that in combination with minoxidil, spironolactone, and PRP, stem cells. They all seem to work.
What about the glow peptide? What have you seen with that?
So with the glow peptide, it really does do a great job with skin and hair. Women that are concerned about hair and thinning, it's a great one to support hair health. I've noticed, a lot of my women that do take it, you notice a difference in their hair follicles. They don't have as much thinning or shedding with that peptide. And also thyroid is a huge one. We have to optimize thyroid.
We keep talking about that because it's so key.
And when I say optimizing, it's not that your lab work looks normal, like it's within range. Almost all my women feel good on a little thyroid. And when it comes to the thyroid, I really do educate my women on why it's so important to take a little bit of thyroid, because most women feel good on some thyroid, and for hair health too.
But it gets frustrating, for men and women. Men often will just think, hey, that's the way it goes. But it doesn't have to be that way if you catch it early. I mean, if you get to my state, I'm pretty happy with being bald now. Or I'm not bald, but if I let my hair grow, believe me, Amy does not like it.
No, like if you're going to go bald, just shave it.
I look like,
and some guys look good bald, and it's not a bad thing. But women, don't want to go bald. It's typically, we wear wigs and things like that. But most women don't want to lose their hair. It's a confidence thing. So there are definitely ways to help support hair health. Like we just talked about thyroid, certain nutrition plays a big role. But when we're talking about stem cells, play a huge role in treatment. And it's a new type of therapy out there. And I've had several questions like, does it hurt? Is it painful? And like you can ask my son, I kind of experimented with him a little bit. I injected him without any lidocaine one time. And he kind of screamed a little bit, but ended up putting a little bit of lidocaine in it with a little bicarb, and actually was not painful after that. So experimenting with a little bit of these treatments has helped, and trial and error type thing.
Yeah, most people don't really have a whole lot of pain with scalp injections.
It's a little sensitive, but putting some lidocaine in there does help with the injection pain. You can use cold treatments or vibration to kind of help with the injections of it. But
so how fast are you seeing results?
Typically
because hair grows in cycles, right?
Yeah,
You're the expert here. Tell us about
hair
that.
Does grow in cycles, and it's kind of hard because it's like trying to teach people to kind of be patient with it, because in about, you'll see results in about 4 to 6 weeks. And that's when you start to see like less shedding. You'll see some regrowth. And just give it some time. You have to be patient with it. But especially with PRP or stem cells, we're doing about an injection every month. 4 to 6 weeks, we're doing an
4 to
injection.
6 weeks.
Yeah.
Okay.
So it won't work on areas that you don't grow hair in, though.
So if you've already lost the hair follicles,
Yeah.
like I have in certain areas.
So if they're completely dead, it's not going to bring them back.
Okay.
But it will bring back the ones that are,
Got it.
you can regrow those. So that's where it does really help with.
What type of stem cells are you using?
So we use the mesenchymal stem cells. We use the umbilical source stem cells. I mean, the ones that you use for joint injections and we use for TMJ injections. And we've seen proven results with these type of stem cells. And so we do use the same type of stem cells.
I think this is just scratching the surface.
Yeah.
I wish I would have known about this in my 20s, but yeah, this is just scratching the surface, and don't wait. Get on it quick.
Yeah.
You know, with hair loss, it's honestly way more emotional than people think, with men and women, but especially with women all the time. I hear, hey, I think I'm losing hair. And it can really make someone feel downtrodden or just not good about themselves. So it's good to get this done as soon as you can. It'll help bring your confidence back as well. And what we're using, is evidence-based. We're not using snake oil here. This is stuff that we know works, or we wouldn't use it, just like everything else in our programs.
And, there's a reason why it's $1 billion business, because of the fact that it's a real thing and stressful, and people don't want to lose their hair. It's a big deal, but there's real proven results out there to help people.
So what would your advice be, Amy, if someone is concerned about that? Where should they start? How do they get this done?
So I would first start with getting hormones checked, making sure, we're optimizing your hormones to where they need to be and where you feel good and where your body feels good. And then adding on a few more things too, if we needed to. I mean, sometimes, like I say, I'll add on spironolactone, minoxidil, some of those things first, or, talk about red light therapy. And I also recommend stem cell therapy if people can afford it. I know it can be kind of a little expensive, but in reality, it might be worth it, because when you lose your hair, you're willing to pay anything for the most part. So, we do start with some of the things that are just a little less expensive, but then we can go on to the little more expensive things.
Do you want to mess around, or do you want to get it fixed? The more you mess around, the longer it takes, the more hair follicles actually die. So I guess my advice, if I were in,
I would try everything. I would try to hit it all at one time. And
I probably wouldn't. I'd probably hit stem cells quicker rather than later. I mean, I would, yeah. If I could do it over again, absolutely.
And to each their own. That's why we offer all kinds of different...
Why be good when you can be great?
So anyways, we offer all kinds. So I just want to thank you guys for joining us today for Look Good and Feel Good with Matt and Amy. And again, if you have any comments or any topics that you'd like us to discuss, please drop them and let us know. Thanks, guys.
Thanks. Have a great week.